Hello, my name is Dr. John Krempecki, and here at Cape Fear Eye Associates, I'm the specialist in pediatrics and developmental vision. Today we're going to discuss 9 myths. You've all heard the saying, don't do that or it may harm your eyes. Today we're going to talk about which myths are true, which are false, and which can actually have significant impact on the vision and the development of the eyes. Myth number 1. True or false? Reading in dim light is harmful to your eyes. The answer is false. For centuries, reading, sewing, craftsmanship, working up close has been done by candlelight or kerosene lamps. In this case, reading or doing anything up close in dim light is not harmful to the development of your eyes. However, it will cause eye fatigue. When the fatigue sets in, that's where we experience symptoms of headaches, and eye strain, and just general discomfort when doing up-close work. Number 2, true or false? Using a computer can damage your eyes. False. Using a computer will not harm the eyes. However, using a computer or other handheld devices for a long extended period of time will cause visual fatigue. The recommended treatment at this moment in time is to take frequent breaks. We can all take breaks while using handheld devices. The minimum time is 20 minutes. For every 20 minutes of work, look away, look 20 feet away, and blink 20 times. This helps to reset the visual system. Once the visual system is reset, you can continue with your up-close work for another 20 minutes. Doing this on a regular interval and taking frequent breaks will prevent eye strain and fatigue while using the computer or other handheld devices throughout the workday. Number 3. Wearing the wrong kind of eyeglasses can damage your eyes. For the most part, this myth is false. However, it is true for younger individuals. Let's start with the false. Wearing the incorrect prescription will not harm your eyes once they are fully developed. The eyes have no maximum developmental age, but typically stabilize between 18 and 22 years of age. So adults who wear the wrong prescription glasses are not going to harm or damage the eyes in the sense of changing their need for glasses, causing them to be more or less nearsighted, more or less farsighted. However, they will induce a lot of visual fatigue, eye strain, and that needs to be corrected with the correct prescription. It is never recommended to wear the incorrect prescription. The true side is with individuals who have not fully developed their vision. Individuals in the younger ages, the single digits or even into the high school years, can actually damage their eyes and cause themselves to be more or less nearsighted, more or less farsightedness because of using the wrong prescription. It can also cause a weak signal to develop between the eye and the brain, causing amblyopia. Just like wearing the wrong prescription, the question is also, can sitting too close to the television damage one's eyes? The answer is false. Sitting too close to the television will not cause an individual's eyes to become more nearsighted or less nearsighted, or more farsighted or less farsighted. It will actually cause more visual fatigue. However, there is a significant number of individuals who have a lot of need for glasses who sit close to the television just because they need the glasses. As a specialist in pediatric and developmental vision, I educate parents on this myth on a daily basis. It is in their best interest not to sit close to the television. My best advice is to take some type of masking tape or painter's tape and put it on the ground where the child currently sits. Then when they're not looking, we move it back a little bit. And we sit down and talk to the child. This is as close as you're allowed to sit to the television. Then, a few days later, when they're not looking, we move the tape back a little bit. And so on and so forth until we reach what's considered a better viewing distance, and that's determined by every individual. Eating carrots will improve your vision. The answer is false. Carrots are very rich in vitamin A, which is important for the development of the retina, as well as normal retinal functions. Certain studies have demonstrated that vitamin A is essential for trying to slow down the progression of age-related macular degeneration. Carrots, again, will not change the need for glasses, nor will it improve your vision. For example, if one is nearsighted and needs glasses to see far away, eating carrots will not improve the vision to the point where you do not need glasses any longer. A well-balanced diet, with or without carrots and vitamin A, is essential for good nutrition and essential for good vision. However, vitamin A as we have determined and the studies have shown is imperative to the development of the eye. People with weak eyes should avoid reading fine print. The answer is false. What we're talking about here is the focusing system, or the accommodation system, which helps us read the fine print. This system unfortunately becomes weaker with age. Between age 40 and 50, individuals most likely start to need reading glasses because the fine print becomes blurred. If we avoid reading the fine print, it will not prolong this problem. One will still need glasses for reading and up-close work after this age. There is one exception. Individuals who are nearsighted and wear glasses for far away can remove their glasses and read clearly up close without any glasses. Wearing your eyeglasses will cause your eyes to be dependent upon them. The answer is false. Wearing the eyeglasses improves the distance and/or near vision. The only thing glasses do besides improving the vision is to change one's clarity or change one's threshold. For example, prior to receiving glasses, individuals' vision were blurry. Once we received the glasses, the vision became clearer. Now when we take off the glasses, the vision that we experience is blurrier than we remember. So we've changed our threshold. We have changed what we remembered was blurry vision compared to what we experience as blurry vision now. If we would go back to actually checking the numbers, checking the prescription, this test is called a refraction, we would find the numbers are exactly the same. Wearing your glasses is important to maintain clear vision. Number 7. Older individuals who develop a second sight are actually developing cataracts. The answer is true. Individuals who are farsighted, and once they develop cataracts, the cataracts harden the lens of the eye, causing the vision to be blurry and distorted. However, this shift, because of the cataracts, can actually make them go from farsightedness to needing no glasses. So individuals with cataracts may be able to not have glasses to see far away. However, the vision is very distorted, very blurred, and oftentimes, even though we don't need glasses, we do not pass the visual acuity requirements to maintain a driver's license. If these symptoms are experienced, a comprehensive eye exam is recommended. A cataract must be deemed ripe before we remove it. The answer is false. Due to today's modern surgical techniques, cataracts no longer need to be ripe. Well, what does ripe mean? Ripe actually is a term for how much vision is lost because of the cataracts. Today, cataract surgery recommendations are based upon lifestyle decisions. Do the cataracts and the decreased vision cause you to have difficulty with driving, reading, playing golf, or other leisurely activities? If you feel you have cataracts and you would like to talk about having them removed, please see us here at Cape Fear Eye Associates. True or false? Eyes can be transplanted. The answer is false. The eye is an extension of the brain. The retina and the other structures attached to the optic nerve, which is the cable that connects the eye to the brain, cannot be transplanted. Modern science has no way to regenerate neural tissue or tissue derived from the brain. Other structures of the eye, such as the cornea, can be transplanted. However, these types of procedures and surgical recommendations are not to be taken lightly. If you have questions regarding eye transplants or tissue transplants, please see us here at Cape Fear Eye Associates. We have discussed several myths and wives' tales about the eyes. If you have any questions regarding these myths, please consult us here at Cape Fear Eye Associates. As always, we stand ready to help you with all of your visual needs.